Congressman, always good to have you. Thanks for coming.
Good to be here.
Do you think, Congressman, given the fact that we're not going to be able to insure everyone, or the savings from this will not be nearly as dramatic as we thought, at least given the CBO, that we should be rushing this?
Well, I don't think we should be rushing this. We've only been talking about it for 60 years. I think we should be doing it. And you got to understand about the CBO. The CBO did not say that the cost of this system would increase the deficit. They said it would be deficit neutral. The increase in the deficit of about $239 billion over 10 years is from something that we're going to do with or without reforming the healthcare system, and that's stopping the otherwise scheduled reduction in Medicare reimbursement rate to doctors, and we're going to do that whether we pass a health bill or not. But the savings with the administration had been clinging to might not materialize. Is it fair to say that's a
might not
or may? It's very difficult to estimate savings, and CBO is constrained by the law that set it up to only look at very certain kinds of very clear things. So it's quite possible the savings will be a lot more than CBO estimates, not because they're not doing a good job, but because the statute that sets them up constrains estimates of savings, although it does not constrain estimates of expenditures.
You know, Congressman, we've heard from a lot of people who are in systems where there is health care provided for everyone, in Canada, for example, and you hear a lot of these stories, including a brain cancer survivor, or malignant brain tumor survivor, I should point out, who said that had she relied exclusively on the Canadian system, she might likely be dead. That there are inevitably, when more people on board a plan, folks who have to wait. Is that inevitable, that Americans will have to wait a little longer for care?
No, that's very interesting about Canada, but no one is proposing a Canadian system in the United States. I mean, some people are proposing a single-payer system, but that's not what's going to happen.
Right.
That's not what the Democratic or the President's proposal is. So it's irrelevant to what we're considering here.
But wouldn't you have that, though, Congressman, if more people are granted coverage, then there's only a set number of MRI machines, CAT scan machines, doctors, neurologists, so there might be a longer line for them, right?
No, I don't think that's accurate at all, because remember, each of us is now paying a hidden tax of about $1,800 on average to care for people who are uninsured.
Right.
They get coverage. They turn up in the emergency room. They get cared for, but they get cared for much more expensively because their diseases or whatever it is are much more advanced before they're seen. If they were covered with insurance, you would have probably fewer of these major procedures because a lot of these people would be caught before they developed a full-fledged heart attack or whatever.
But that would be detected or have to be detected on MRI machines and CAT scan machines, of which there is a finite number, right? So you would wait for that, right?
Or simply by a normal exam with a stethoscope or an electrocardiogram, an ECG or whatever.
Right. Well, let me ask you this, Congressman.
Because people would come into it earlier.
Got you. You had said that the system you enjoy in Congress is something you'd like to provide for everybody. Would it be fair to say then, if this passes along your liking, that you'd give up the health plan you have in Congress and opt into this plan?
Well, first of all, I'm not in the congressional health plan. I'm covered by my wife's state plan, which I think is better than the congressional plan.
Really? Even better than your? Wow, that's pretty good. Okay, go ahead.
Yes.
Sorry.
It's state employees or union employees in New York City and New York State. But be that as it may, essentially what we're setting up is that everyone will have a similar plan to the federal employee health benefits. We're not setting up a Canadian plan.
Right.
What this bill says is essentially is you stay with your insurance if you like your insurance, but the difference is your insurance company will no longer be able to screen out people for pre-existing conditions.
All right.
If you should lose your job, you can go and get new insurance regardless of pre-existing conditions, etc. And we're setting up a market for insurance companies and for a public plan to compete with each other. X number of private plans and one public plan for your business.
Well, let's hope it works. As on paper, it sounds like it could work out. There are just a lot of agita as to whether it will. But Congressman, always good having you on. Thank you very, very much.
Good to be here.